Hi, welcome to my channel Nursing Medicine. Today I came with the second sample station of aptitude test in Ireland. So let's see this sample station. Start the scenario. Here is your scenario. Mrs. Kavanagh is an 82-year-old frail woman. She is below average in build, has very poor appetite. Her skin is very dry. She has restricted mobility and has occasional incontinence. She has a history of diabetic mellitus and cardiac failure. Both conditions are well controlled. Her Waterloo score is 20 plus and she is considered a very high risk of pressure ulcer. She was admitted for a review of her current medication for Parkinson's disease. That's a scenario. And your question is, based on the Waterloo score assessment and specific to the pressure area care of this patient, write a narrative indicating what members of the interdisciplinary team need to be involved in this patient care, giving a reason for the choice made. To ensure care is appropriate and effective, communicate clearly and accurately in writing. That's your task. You saw the question, what is your task? Your task is to write what you have to do for this patient. Her Waterloo is 20 plus. According to that what you have to do for this particular patient, she is admitted here. So here what you have to look is like your task is to just write whatever is necessary for this patient. So you know the patient has Waterloo is 20 plus, that means very high risk of pressure ulcer. Here first of all you have to inform the CNM. So you can write, you have to inform the CNM to order a pressure relieving mattress or any other equipment, cushion, etc. That means we have different kinds of, when I told about the pressure ulcer, I have mentioned about the management. If you don't know about the pressure ulcer, you can go to my videos and you can see what is pressure ulcer. So in that I have mentioned about the pressure relieving mattress. That means some air mattress or something which helps to relieve the pressure between the surface and the skin, that help to prevent pressure ulcer. So first of all, we have to inform the CNM regarding ordering of a pressure mattress. Then second, we have to inform tissue viability nurse. It's a specialist nurse which is dealing with the wound care management. So they have to come and see the patient too, because she is of high risk of pressure ulcer and she has diabetic mellitus. So you have to write in detail why you are recommending them to the tissue viability nurse. If you are recommending this is for this one to assess this and Waterloo is high, diabetic mellitus, these all things you can mention there. Then you have to refer them to the physiotherapist. Physiotherapist is for passive and the active exercise has to be reassessed this for particular patient. Then next you have to refer this patient to the occupational therapist. Occupational therapist will come and assess them and they may just provide some of the wheelchair or what all other things which is necessary for this patient. Then you have to refer this patient to the medical team because she is dehydrated. It was mentioned in the question. So for rehydration, the medical team has to be ordered some kind of subcutaneous or something like that. So you have to refer them to the medical team. And you have to tell your care assistant to give more food and fluid to this patient because she has very poor appetite. It's mentioned in the question. So you have to inform your care assistant to give more food and fluid or feed them if it's necessary, and make sure they are changing her position frequently when she is in the bed. So these all are the things you have to write in that task. So here nothing is there, just you have to write what you are going to do this for this patient. You got the scenario and you got the question according to the water loss score, what all of the things you are going to do. That's what you have to write. So if you are referring to one person, you have to mention in detail why you are referring. So that's the question here. So you are going to tell to the CNM about the mattress and physiotherapist and this one dietitian. I didn't mention about the dietitian because she has poor appetite, so of course we have to refer her to the dietitian. This dietitian will like assess her and maybe she will give some of the supplement to her. So that all things we have to do. So the MTT included the CNM you have to inform, then physiotherapist, dietitian, tissue viability nurse, then your medical team and your care assistant. So these all are the staff you have to communicate for the intervention of this particular patient. I hope you understood about this. All about the other sample station. I'll come with another sample station in my next video, and don't forget to subscribe Nursing Mate EC, and you can press the bell icon so that you'll be notified with my new videos. Bye bye. I hope you all enjoyed my video. Bye bye. See you.